Let's discuss diagnosis according to Zhang organ patterns. For today, we discuss lung Qi deficiency. Lung Qi deficiency can arise independently, but will most often be seen together with spleen Qi deficiency or heart Qi deficiency. When there is lung and spleen Qi deficiency, there will be a general condition of Qi deficiency characterized by a poor production of Qi, whereas lung and heart Qi deficiency will be a more emotional imbalance with sorrow, grief, and a lack of joy as the dominant symptoms. Now let's talk about its etiology. Lung Qi deficiency can be caused by a respiratory illness in childhood. Poor posture, where the person sits slumped forward, can inhibit the Qi mechanism of the lung and thereby weaken lung Qi over time. Furthermore, a lack of exercise will mean that the Qi mechanism in the upper jaw is not supported by physical movement. Lung Qi can be weakened by repeated invasions of exogenous pathogenic Qi, or if there has been an invasion of exogenous pathogenic Qi that has not been properly resolved, for example, through the use of antibiotics. The lung is emotionally affected by grief, sorrow, and melancholy. If the person has experienced repeated or excessive grief and sorrow, especially if the grief remains unresolved, it will bind and weaken lung Qi. Lung Qi is weakened by excessive talking or singing. This is because zhong qi is used to create the volume of the voice. This means that teachers, lecturers, actors, and singers can have a tendency to develop lung Qi deficiency. Excessive consumption of spicy food can spread and expel lung Qi through the pores of the skin. Finally, it can be an aspect of other Qi deficiency patterns, and therefore their etiology can also be involved in the generation of lung Qi deficiency. Now, for its symptoms and signs, there will be fatigue, shortness of breath, shallow breathing, slight cough, possibly with watery sputum, a weak voice, reluctance to speak, sweating spontaneously or sweating on slight exertion. There will be aversion to cold and drafts, frequent colds and respiratory infections, bright white complexion. The person will have a slouching posture. The chest can appear sunken and shoulders slump forwards. There will be pale or normal colored tongue. The front third of the tongue can be depressed and hollow. There is a deep and weak pulse, especially in the right tone position. Its key symptoms are fatigue, slight breathlessness, spontaneous sweating, weak voice, and a weak pulse. For its treatment principle, we tonify lung Qi. In acupuncture treatment, we can choose from points lung 1, lung 7, lung 9, UB13, stomach 36, spleen 3, REN 6, and REN 17. We use the tonifying needling technique, and moxa can also be used. To explain further, lung 1, lung 7, lung 9, and UB13 tonify lung Qi and regulate lung Qi. Stomach 36, spleen 3, and REN 6 tonify Qi in general. REN 17 tonifies zhong Qi and regulates Qi in the upper jaw. Because this is a Qi deficiency condition, we advise even for spleen Qi deficiency, and kidney Qi deficiency will also apply here. That is, the person should eat a diet that is nutritious but does not weaken the spleen. Food that is white in color will often have an affinity with the lung and can be used to focus Qi tonics on the lung. The person should avoid consuming food that is very spicy because it will spread and thereby weaken lung Qi. Foods that particularly strengthen lung Qi are turnips, daikon, radishes, parsnips, parsley, onion, garlic, tofu, berry, walnuts, almonds, cauliflower, dates, figs, duck, tuna, grapes, thyme, and ginseng. Ginger tea will also be beneficial. It is important that a person who is lung qi deficient does not strain their voice because it will weaken the lung qi. A person with lung qi deficiency must ensure that they get enough rest and do not overexert themselves. However, light exercise and movement will be beneficial because they will open the chest and support the lungs' qi mechanism. Going for walks in fresh air will be salutary, because the person will get some light exercise and the fresh air will nourish the lung. Yoga and Qigong will often utilize breathing exercises that have a beneficial effect on lung qi. It is important that the person who is lung qi deficient is conscious of their posture, because a slump posture and sunken chest will strain lung qi. If there is an emotional aspect to the lung qi deficiency, the person should try to resolve these issues. Lung qi deficiency can be caused by the following patterns of imbalance: spleen qi deficiency, heart qi deficiency, kidney qi deficiency, invasions of exogenous pathogenic qi, and stagnation of qi in the upper jaw. In turn, this can result to the following patterns of imbalance: spleen qi deficiency, heart qi deficiency, kidney qi deficiency, weight qi deficiency, lung yin deficiency, stagnation of qi in the upper jaw, and phlegm in the lung. So to summarize, lung qi deficiency has its etiology in hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness, weakening the lung qi, repeated impairment of lung qi diffusing and descending over a long time. Its signs and symptoms are shortness of breath, panting worse on exertion, forceless cough with a profuse watery sputum, a weak voice, spontaneous daytime sweating, dislike of speaking, a pale or bright white complexion, easily catches cold, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling in the upper back, and absence of thirst. The pulse is weak, especially in the right front position. Tongue is pale, slightly wet with white fur. For its treatment principle, we strengthen lung qi, support defensive exterior. The acupuncture treatment can use lung 9 to supplement lung yang, Ren 6 to supplement original qi and fortify the yang, Du 12 to relieve cough and dyspnea, Ren 12 to supplement earth to strengthen metal, Rudder 20 to supplement the spleen, and lung 7 to promote descending of lung qi, bladder 13 to supplement lung qi, stomach 36 to supplement stomach and lung qi, bladder 43 to supplement the lung, spleen 3 as the source point of the spleen. We needle with supplementation and use of moxa if required. Thank you for listening.